Hey everybody, today we're going to be talking about Heart Disease 101. One of my colleagues just posted an article where they're talking about the 3 legs of heart disease, and this is a really great conversation to have with your doctor. What I'll do is I'll put the research below this video, but we're going to be talking about the lab test that can help you understand what's going on with your heart health, with your vessel health. This is very important, especially when it comes to heart attack risk and stroke risk. So in this video, I'm going to be going through all of these labs. I'm going to be telling you what I learned from this article and how you can have this conversation with your doctor to help make sure that you have a decreased risk for heart disease, that you're addressing every part of it. Because the standard medical model, they're just mainly testing these lipid profiles, which are important, but they're not addressing insulin resistance and they're not addressing endothelial dysfunction, which are key components when we talk about heart disease and your risk for stroke. So when we want to have a very comprehensive approach to heart disease, because this is the #1 issue in America right now, is that we need to address 3 different systems. So we need to address any lipid dysregulation. So this looks like all your standard lipid profiles that you're usually always run. So this is like your LDL cholesterol, your HDL cholesterol, your regular cholesterol, and the ratios that come with those. And there's more science coming out behind this about the smaller particles, the bigger particles, the fluffy particles, which we're going to be talking about in this section once we get to it. So the next part of this is the endothelial dysfunction. This is the actual lining of your vessels. And so if there's dysfunction in the lining of those vessels because they secrete hormones and proteins and other chemicals that help keep your vessels nice and healthy, then that can lead to the clogging of the arteries, and that can lead to the potential heart attacks and strokes. And then the last one, which is really big right now that a lot of people are talking about, that it's estimated that 80% of Americans have some form of insulin resistance. This is when insulin isn't going into the muscle cells, it's not going into the fat cells. This is a very key component, especially since diabetes is growing, and any type of metabolic dysfunction, any type of blood sugar issues really stem from this portion right here, which we're going to be talking about how to identify if you do have any type of insulin resistance. So in the article, what my colleague talks about is that over treating thousands of patients, he's noticed that there are 3 different legs to the stool when it comes to heart disease. So your regular doctor may run your lipid panel and they may say, hey, everything's fine. You may be on a statin to help lower your cholesterol, but we have to ask the question, why is your cholesterol high in the first place? And just if you went to your house today and the police were there and all your things were gone, you may assume that the police robbed you, but that would actually be a false thought process. In reality, the police are just there at the scene of the crime because they're trying to clean it up, trying to figure out what's going on. When we talk about why your cholesterol is elevated, usually it's due to inflammation within the body, which is where cholesterol comes in and it tries to patch or downregulate any of the inflammation that's going on. But what causes inflammation in what they're finding now in most heart disease cases is that it's sugar causing inflammation, because there are all these artificial sugars that are out there. Sugar is highly inflammatory. Now, it can be coming from a bacteria, virus, another toxin, but in most cases, what we're looking at that people are just eating way too much sugar these days, and it's coming from a dietary standpoint. So how do you combat that? Obviously, downregulating your sugar intake. Other ways that you can do this are taking supplements like berberine, alpha lipoic acid. I just made a video talking about the #1 supplement for heart disease, which is vitamin K2, which has actually shown to reduce the amount of plaquing in the arteries, which is a very great finding, So, all these people that are on these medications for it, just use vitamin K2. And you can actually use these levels, talk to your doctor, send this video to them. You can talk to your doctor about how trying K2, how it can actually decrease these risk factors. So let's go over lipid dysregulation first. So what you want to see, especially if you're working with somebody who may be an alternative to, medications, or maybe they're more of a holistic practitioner, is that these labs are going to be what you want to look at when you're looking at overall lipid dysfunction. So it's not always just your LDL, your HDL, and your cholesterol and your triglycerides. There are a lot more components that go into this. So with this, there is LDL-P, which you want to be below 1,000. There's LDL-C, which you want to be below 100. There is small LDL particles, which you want to be below 527. There is the HDL-P, which you want to be below 30.5. There is the HDL-C, which you want to be, this is greater than 30.5 for your HDL. And then for your HDL-C, greater than 39. Now you have your non-HDL-C, which you want to range between 90 to 110. Your lipoprotein B, which you want to be less than 90. And then your lipoprotein A, which you want to be less than 75. These are inflammatory markers when you're looking at vessel health. And then obviously you want your regular cholesterol to be less than 199. Anything above that, then your body is telling you something, that there's an inflammatory response, that you're very stressed out. Obviously you have your regular HDL. You want that to be greater than 60. And typically you get that from good fatty fishes, good healthy fats, not trans fats. This can come from saturated fats. Then you have your HDL to cholesterol ratio, which you want to be greater than 0.24. So that just means that you want a higher amount of HDL compared to your cholesterol. And you just take your HDL, whatever it is, and divide it by your cholesterol, and it gives you that ratio. You have your VLDL, which you want to be less than 30, your LDL less than 99, your LDL to HDL ratio, you want that to be less than 3.6, and your non-HDL cholesterol, which you want to be less than 129. So I know that that's just a lot of rattling and numbers, but this is the optimal range that you want all of these markers to be in. Now, this is a more comprehensive profile that maybe your primary care isn't running or your cardiologist isn't running, but that will tell you a very comprehensive approach about inflammation patterns in your body and what's going on from more of a hormonal level. For me, is what that says. Just, is your body in a very stressed state? Is there something else going on that you need to look at? Do you have an infection? Are you blowing out your blood sugars? Do you have one of these chronic disease issues that are so common nowadays? Now, the next thing that we're going to go over is the endothelial dysfunction. So endothelial dysfunction, I had to look some of these up. So I don't know everything, so I don't want to pretend that I do. But when we talk about, I thought that this was a pretty interesting marker. It's asymmetric dimethylarginine, which is an amino acid that circulates in plasma, urine, and tissues and cells. And what it does, it actually inhibits nitric oxide. And for our patients who have neuropathy or any type of vascular issues, nitric oxide is one of the key components to helping those patients recover. And so if this is high, you want it to be less than 100. If this is high, then you're inhibiting your natural synthesis of nitric oxide, which is bad. Now, there are ways that you can increase that. You can, eat beets are a good form. We use a light therapy device that stimulates nitric oxide and causes angiogenesis, especially when we have vascular damage in the feet and the hands, which is very important for our neuropathy patients. But I thought that that was an interesting marker that I didn't know, but something that you can check out, because if it's constantly inhibiting nitric oxide, then you can't really out-supplement that. You need to figure out what else is going on. And then the myeloperoxidase, this is released during foreign invaders, so bacterial infections. So if you have some kind of chronic bacterial infection, viral infection that can be causing inflammation in the vessels, this could be autoimmune issues. This could be, looked at in Raynaud's. And if it is greater than 470, you want it to be less than 470, then you may have some sort of autoimmune issue causing damage to the blood vessels. So very, very interesting marker that I didn't even know about. And then this lipoprotein, what is it? PLA2 is an enzyme. Oh, this is showing your oxidation of your LDL. And with this, you want it to be less than 200, because if it's greater than that, then you have a lot of oxidation going on. If you think about a car rusting, that is oxidation. So your vessels are essentially rusting and your body and tissues are rusting when this gets higher than 200. Uric acid, we always see that in gout. You know, that can be very common, especially if you're drinking a lot of red wine or beer or eating too much red meat. Now, I'm a proponent of eating some red meat, but as far as that goes, if you're having this issue, you probably need to look at digestive issues when it comes to this, and you need to look at your overall diet and see if you can, combat that. Homocysteine, this is just an inflammatory marker. You want to see this should be anywhere between 7 to 9. Anything more can indicate that maybe you have a methylation issue. That's very common in MTHFR issues. And so you want to look at methylated forms of B vitamins when it comes to homocysteine. High sensitivity CRP, this is C-reactive protein. You want it to be less than 1. Anything greater than that indicates an inflammatory issue going on in your body. And then oxidized LDL is very similar to this, but you want this to be less than 60. That comes back to that oxidation rust issue in your body. So you want that to be low as well. And now the bread and butter of this, pardon the pun, is that insulin resistance. So this is something that I already knew about. It's very important for our diabetics to get these checked, because if they do have this, and you see a lot of times diabetics will have heart issues and kidney issues, and everything just goes hand in hand because everything is connected. But with insulin resistance, you want your glucose, especially fasting, to be below this 100 mark, so below 99. Anything above that means that you probably have some insulin resistance going in. It's not able to push the glucose into the blood, and it's staying in your bloodstream for an extended period of time. When you eat and your blood sugars go above 140, that's when you start getting nerve and tissue damage, and that's what happens when you're talking about peripheral neuropathy. Triglycerides, you want those anywhere between 85 to 110. Triglyceride to HDL ratio less than 2. So you take your triglycerides divided by your HDL, that gives you that ratio. You want your A1C less than 5.7. I hear so many people that say, oh, it's 6.5 or it's 6.7, I'm doing good. And really it's not. You're actually still getting damage to the neurological system. You're getting damage to the muscle tissues, pretty much everything in your body. So you have to control that A1C, guys. It's very important. And then fasting insulin, you want to be less than 7. When this is higher than that, then that means that you have insulin resistance, that it's not able to attach to the muscle cells, the fat cells, and it's staying in your bloodstream longer. And so that is a bad sign, because you're never going to be able to push glucose, which is going to stay in your bloodstream, which inadvertently causes inflammation in the vessels and can cause the plaquing of the vessels. So I know that this has been a lot. Hopefully, if you need to go back and watch it again, please do so. But if you have any questions, please just comment below.